Hi, it's Jerry. Thanks for joining us today. We're talking about CO2 therapy, and I'm with Neal Sivula today, a local veterinarian to the East Coast. And he's got a great veterinary practice called Dancing Paws Animal Wellness Center. Hi, Neal.
Hi, good to talk to you.
Thanks for joining us today. And I'm really interested and excited to, I just finished reading the case study about Duggan and the canine that you treated, your canine patient. And I thought maybe that would be a great way to talk about, your using of CO2. But before we do that, tell us a little bit about your animal practice.
Thanks. We're located in Northeast Ohio, so we're halfway between Cleveland and Akron, Ohio. I'm the only doctor. We do strictly holistic medicine, so acupuncture, chiropractic, rehabilitation, herbal medicine, and a little bit of CO2 therapy as well.
So you work in conjunction with other veterinarians. Is that how does a patient, learn about you in the holistic practice? Because usually, we'll go to the traditional people first. But how does that work?
You bet. So we're part of the pet's healthcare team. So we may get a referral. The client may get a referral from their primary care veterinarian or a specialist that they've been working with, or most often, actually, clients refer other clients. But yes, we handle the holistic.
So you work
part
in
of their
conjunction.
care.
That's a really wonderful improvement, I think, to the veterinary world. We've been talking about CO2, and you've got some experience there. But I'm really interested in hearing about this wonderful case that you did with Duggan, the 11-year-old. What kind of dog is he?
Well, he's kind of a wolfhound. Yeah.
Okay.
He has a chronic elbow arthritis, which is a really for us, it's a really difficult and frustrating kind of arthritis to treat. It's hard to get medication to that site. Lameness always seems to be niggling. There's a lot of back and forth, and we oftentimes try a lot of things and have to experiment a lot with what might work. And so he was a great case because the owner was willing. He was local. He was willing to come in. He actually responded very well to the treatment. He came in initially a couple times a week, and he wore the sleeve very well and sat really nicely for the therapy and started to show improvement after a couple of treatments.
Well, can you kind of walk us through what it was that saw or why you thought the CO2 therapy would be, a viable therapy in this case?
The science completely makes sense to me why the CO2 can help with oxygen transport and increase circulation and relieve pain. And with Duggan, we had been through a lot of trial and error of things that weren't working. And he was actually the perfect candidate because, again, he was local and he was a nice, quiet dog, and the owner was willing to participate and come in and get those treatments on a regular basis. He was a good one for me because it was something that we tried a lot of other things with and hadn't really gotten anywhere.
And I'm wondering too, generally in your practice, what are the types of, I don't want to say illnesses, but what are the type of treatments that you typically are giving, or the types of injuries or illnesses that present typically in your practice? Are they like the arthritis case, or do you see a wide variety of things in your practice?
We see a lot of patients with arthritis. So our practice has always been case heavy in older patients, so geriatrics. They have a lot of arthritis, and so we get a lot of chronic disease. We get a lot of arthritis. We get a lot of neurologic problems, and so the application of the CO2 device is right up our alley.
You mentioned that Duggan was a really good candidate. He sat quietly, was a cooperative patient with regard to the therapy. But how did you administer it?
He would come into the office, and we have a couple of exam rooms in the back of the clinic that are a little quieter, and that just worked better for us to be able to have him and his owner back in a quiet exam room. A technician would wet Duggan's hair, and I would position the sleeve and inflate the sleeve. And then a technician might either sit with him if they want to chat with Duggan's owner, or they might leave the two of them for the 20 minutes that we applied the therapy, check in on him from time to time. But he was such a good patient. He didn't really need babysitting. We had another case with elbow arthritis that was a bit more boisterous, and the technician did just sit back with that owner and the pet while she was being treated because she was a little bit more up and down and needed a little bit more supervision, but it's no big deal.
Yeah, and sometimes we're told that once they go through the initial therapy, that they really adapt to what's going on around them. Would you agree with that?
I would totally agree with that because, like a lot of things, is we have the advantage that our practice, because we don't do any traditional work, the pets understand that when they come, they're not going to get anything that's uncomfortable or painful. And certainly with the therapy, the CO2 therapy, I mean, pets are smart. And once they get the idea of what's involved, then they can settle right into a routine. And the
Mhm.
owners are a big help with that. If the owners understand the process and what's going to happen, and they can see, after a treatment or two, that it's no big deal to do the treatment, everybody's relaxed.
And that's great news, for especially when you mention that it's an older dog and these are the kinds of problems that present in us as humans and as well as with your dog patients.
Yeah.
Once you saw the improvement, let's say in Duggan or the other dog you referred to, what's the therapy ongoing? So you've done the initial treatment, you see the improvement. How much longer do you think that a dog in a situation like the osteoarthritis would have to continue to have the therapy?
We went through with both dogs, we went twice a week for 4 weeks, and then we tried to get them back in even every couple of weeks, depending on how they were doing. Dugan he's a little less boisterous, so he tended not to create flare-ups in his condition. The other dog that we worked on was younger and a bit more boisterous, and so she was tweaking herself a bit more. So we tried to stay on top of her a little bit more. Ideally, I think with cases like those that we might go every couple of weeks and then try to get them back once a month for a maintenance visit, just depending on how they do.
And what's the size of these two dogs? It's interesting that you brought two up, one that's boisterous, one that's less so.
Yeah.
Was there a size difference too between them, and therefore the therapy was a little bit different for each dog?
They were pretty close in size. The other dog was a German Shepherd, so they were probably in the 70 to 80 pound range apiece.
Good sized dog.
Mm-hmm. Yeah.
Well, thank you. I really appreciate learning about this. I know that the folks that are coming into the channel will be interested in hearing your story and hearing about your experience. Anything else that you feel is important for you to share with regard to using CO2 therapy?
I'm really excited about the possibilities. I've got some limited experience. I'm looking forward to using it more because of the science behind the therapy. I'm looking forward to using CO2 as in conjunction as part of the treatment plan for dogs with systemic illnesses that need immune support. Just my geriatric caseload, a lot of those dogs could use extra help. And I'm thinking that the benefits of the CO2 therapy for just overall well-being, we're just at the tip of the iceberg for that.
We're so excited. And we're with you on this. And we really are so proud of the teamwork that we've established with veterinarians like yourself, Neal, and are so excited to just bring this product out to everyone, the trainers, the owners, the veterinarians, and wherever it'll go from there. So we're thrilled to have you and in our partnership.
I'm happy to be here.
Great. Thank you so much and take care. I hope that we can chat again and share some more stories in the future.
Oh, I'd love to.
Great. Thank you so much, Neal. Take care.
You're welcome. You too.